Now, this is optional for you at this time. Due to the pandemic, it's hard to examine patients at close quarters, and ophthalmoscopes are not cheap, and there's no point purchasing an ophthalmoscope if you're not going to use it, unless you plan to sell it. So what we're dealing with now are optic disc abnormalities. In any case that you did perform the fundoscopy and you saw something more than just a red-orange reflex. So this is how it would look like. So this is from a fundus photo of what a normal disc should look like. And if you had the patience to really look around and look for the fovea over here, which is a dark red spot, the normal optic disc is very clear cut. You can see the blood vessels traversing on it, no problem. You can see two types of blood vessels, the lighter red one and the darker red ones. So the darker red ones are actually the retinal veins, and the lighter red or brighter red ones, meaning not dark red, are the arteries. So they characteristically form branches around this area of the optic disc and arch over it. Versus, okay, this is just a close-up view of that normal optic disc. So how do we describe it? The disc borders are clear-cut, meaning they have distinct disc borders. You have this so-called optic cup versus this optic disc. Usually it's around, the ratio is 2:3 in terms of the size of the disc. I mean the disc head, the cup, optic disc cup versus the optic disc itself. So that's the normal. You shouldn't see anything else floating around in there. Normally there should not be blood floating inside there. Comparing it to this, so flashing the previous one, flashing it this one, the difference here is like the optic disc is not getting enough blood in this case. And what else? If you see here the pattern of the blood vessels normally versus the pattern of the vessels here, you see here cut-offs in the blood vessels, meaning the optic disc itself is bulging at you, forward at you. That some parts of the arteries are being bent with the pressure, so it's being pressed from behind. Thus the blood vessels, if you're catching it with a picture, you may catch the blood struggling to go to the other side. So you have this cut off of blood vessels. And the disc margins, which are clear here, which are distinct, are no longer seen. You don't know where the disc ends and where the retina begins. So at the very least, we can describe this as indistinct disc borders or blurred disc margins or obliterated disc margins. The second thing is, I said, normally there shouldn't be any blood in this area. Here, when the swollen disc has been pressing with some time and some of the blood vessels are damaged, you would actually see hemorrhages or bleeding here into the blood vessels where they're being severely compressed. So this is what they call a choked disc, meaning there's not enough blood going to, it's blanched, it's already differing in color versus the normal color that we see here. So when I instruct my students how to look for the optic disc, I say look for the sun. So the sun is your optic disc and you'll see blood vessels on it. So if you're looking at it, if you happen to have a ophthalmoscope at the time, you can look at your household member and just catch the red-orange reflex first, and then if you find a blood vessel, follow it. If you follow it and it branches further, then it means you're going further away from the optic disc. But if you follow it and you see it converges with other blood vessels, then you've found the optic disc over here. So some pigments can be seen depending on the degree of the color of the skin of the person you're looking at. Okay, so that's the optic disc. This is abnormal. This is a swollen disc, optic disc. So they would present in what I showed you earlier, a very enlarged blind spot, if not a very blurred vision, like 20/200 already on visual acuity. So here's a side-by-side showing that this is not a normal optic disc. This is a normal optic disc. These are normal blood vessels. These are not normal blood vessels. And there are no hemorrhages here. There are hemorrhages here. And here you can see some fluid actually coming out of the blood vessels. That's what we call edema or exudates, meaning the fluid that should not be there appears there. That's an exudate. Okay, so just showing this for clarity purposes, what happens to the blood vessels in your optic disc in a normal disc versus a disc where it's very swollen. So the blood circulation is not very good here, so it's a very choked optic disc. Okay, so flashing you that slide, so that very swollen optic disc with hemorrhages and very indistinct disc margins is what we call edema or swelling of the optic disc head or the papilla. So edema of the papilla is papilledema. So there are newer technologies now from the ophthalmology side. This is a optical coherence tomography, which shows you the normal optic disc versus a very swollen optic disc, meaning there's pressure inside the brain pushing out the optic disc head into the eyeball over here. So that means the pressure must be very, very high inside your intracranial cavity. This is the importance of the lectures of the skull from Dr. Seng, importance of the visual neuroanatomy from Dr. Batikalon, and we'll delve into the intracranial pressure in the last days of our OS 202. Okay, so again, papilledema.